Let's talk about the different types of reconstructive surgery because there are several procedures. The first one that we hear a lot about is flap. There's fat grafting and tissue expansion. So I guess first let's talk about flap.
That's right. So when we talk to our patients about breast cancer and breast reconstruction, there's really two major pathways. And those major pathways are either breast reconstruction with an implant or breast reconstruction involving your own tissues. The flap would be using your own tissues. And in the majority of our hands these days, that involves a microvascular transfer of tissue where we actually transplant tissue off of the body from one section and re-implant it into another part of the body. Almost say you're having a kidney transplant, but instead of a kidney, it's your abdominal tissue to your chest, but it's very much the same thing, completely detaching that tissue. And that has a lot of risks in the reconnection of the tissue. We reconnect them under a microscope, very small blood vessels. They're very delicately sewn. And then we have protocols for monitoring how that tissue is reacting afterwards and whether or not we need to go back and relook at that hookup. In general, problems with that hookup happen around 4 or 5% of times. That requires going back to the operating room to take a look at the connection. And then in those patients that have to go back, that, about half or 70% of those we're able to save all or parts of the tissue. So when we talk about what is the overall risk of someone not having a successful flap operation, in experienced centers, high volume centers, that runs around 2%. So that's an important number that we talk about. The beauty of that operation for candidates who are able to do it is you have all your own tissues. There's no implant to worry about. It's soft, it looks like a breast. It's the best match for the tissue that has been removed. But not everyone has the ability to donate that tissue. Most often that comes from the lower abdomen, and so people have to have enough lower abdominal tissue.